I'd like to introduce you to the OCT, or the Optical Coherence Tomographer. This instrument is a fantastic tool we use to evaluate the front, the middle, and the back of the eye. It was originally created for evaluating the retina and the optic nerve, so the retinologist and the glaucoma specialist embraced this tool, and the newer generations allow us to see the front of the eye. I like to use this not only for those purposes, but also to even evaluate the fit of contact lenses on the eye, and I'll talk more about that under the heading of scleral lenses and corneoscleral lenses. So the OCT used for the retina is a fantastic tool to look for wellness of the back of the eye. We can see things that we simply couldn't see before. There are layers of the eyes that we knew they were there, but basically you couldn't see them because they're kind of clear, and this allows us to separate those out. We are better at diagnosing disease and managing disease and treating disease than we ever were before. So with the retina, this instrument allows us to look for the different layers in the back of the eye, and we're looking for elevations and depressions. I like to use the analogy of a angel food cake that's nice and fluffy, and versus it becoming a pound cake which is condensed. The diabetic, the hypertensive, tumors, detachments, all sorts of conditions in the retina can be found and evaluated to this. And fantastically, once you find a condition, you can then follow it for changes over time. It does a fantastic job of benchmarking that image in that retina, and then it can overlay images that occur later, and you can look for change over time. So for the retina, the OCT is an invaluable tool for those purposes. The OCT is also used to evaluate the optic nerve and the diseases and conditions that are associated with the optic nerve. The optic nerve can be elevated or depressed. It can be healthy, it can not be healthy. We look at the optic nerve constantly to evaluate and think about glaucoma and changes that happen to the optic nerve. So light strikes the retina, that information is communicated along wires or nerve fiber layers, and it exits out to the brain. So optic nerve elevation, depression, I communicate a lot of this information to neurologists when their patients have conditions affecting the optic nerve, and the OCT is a fantastic tool to monitor, diagnosis, and manage these patients. The glaucoma patient, lots of considerations are given on a constant basis as to the wellness of the optic nerve and some characteristics of it, of what's called cupping, and we can now look with micron specificity at the cup of the optic nerve and find small changes that are occurring and intercede sooner than we would have otherwise without the OCT. The OCT can be used to evaluate the front structures of the eye, the cornea, the anterior chamber, for the glaucoma patient, for looking for the drainage of fluids there. And it's a great tool to look at thickening and thinning problems there as well. I have been very aggressive in looking at what's in front of the cornea or contact lenses, and looking at the effect certain contact lenses have on the eye and the fitting of contact lenses to the eye. There is a growing interest in use of the OCT to evaluate rigid gas permeable contact lenses on the eyes, cornea, corneoscleral, semiscleral, and scleral lenses, all these different lens sizes that we use and fit on the eye to afford people great vision for healthy eyes and to remediate problems when there's unhealthy eyes. I'll show you a few little side videos on what we do and how we evaluate the fit of contact lenses on the eyes.